I'm Joaquín Beltrán. I'm the creator of Speak of America, and I'll be helping to moderate the panel. On the panel, we have Whitney Antrim, who's a trustee at Coronado Unified School District and an attorney specializing in education law. We also have Dr. Carolyn Cannuscio, who's an epidemiologist who studies school outbreaks and runs contact tracing efforts. Additionally, we have Dr. Lisa Delano-Wood, who's a clinical neuropsychologist at UC San Diego, co-founded Californians for Safe Schools. We have Dr. Andrew Goldstein, medical doctor, grassroots political organizer, and primary care doctor. We have Dr. Alex Huffman at the University of Denver, aerosol scientist and concerned parent. We have Dr. Elizabeth Jacobs from Arizona, epidemiologist from Tucson, and who helped start Right to Safe Schools, AZ. We also have Mary Germanos Saba, political economist and organizer with Mass Coalition for Health Equity.org. And finally, we have Dr. Lucky Tran, who's a scientist, science and public health communicator, activist, organizer with March for Science. So welcome to everyone. Please go for it. We'll start with Whitney. Please take a minute and share your current experience with Delta in schools.
Thank you so much, Joaquín. I am here today as an attorney and as a trustee, so providing a lens of governance, meaning practically, what can a school board do and how can parents and community members advocate to get these implements into our schools during this rise of Delta? And then as an education attorney, what are our rights and what can we be looking at, again, practically? What do we do, those of us that don't know the science behind this, but want to make a difference in our schools?
Fantastic. So good to have you here. Okay, and then let's hand it over to Dr. Carolyn Nucio.
Hi, I'm an associate professor at the University of Pennsylvania and trained as an epidemiologist. Throughout the pandemic, I've been running contact tracing efforts and have been consulting to schools and investigating outbreaks that have occurred in school settings and in childcare settings. And I'm here to just remind all of us to lead with empathy, plan for when cases occur so that they don't become outbreaks, and to have our plan be in place if schools have to go online again this year.
Thank you so much, and lead with empathy. I think that's incredibly important, so thank you. Next, we have Dr. Andrew Goldstein. Please.
Hi, everyone. My name is Andrew Goldstein. I'm a primary care doctor and political organizer, and my experience in the pandemic has been extreme outrage as we dragged our feet in the initial days of the pandemic around things like stay-home orders and scaling up contact tracing and mask mandates. And then through the pandemic, have for the last 9 months or so been involved in organizing to end global vaccine apartheid. And that's been part of a coalition of organizations in the US. And most of all, I'm here though, because I've personally experienced feeling politically powerless, and ever since feeling a post-Trump call to political action, have just dived into all the things that we can do and become more fluent in the political toolkit, and gotten over my own hesitations and discomforts. And I think all of us have a lot more power than we realize. And I'm here to be able to talk about how people power can get us the policies that we need and deserve.
Absolutely, and great to have you here, Dr. Goldstein. And Dr. Alex Huffman, please.
Hi, great to be with you. So I'm Dr. Alex Elfman. I'm an associate professor in the chemistry department at the University of Denver. For nearly 20 years or so, I've been studying aerosols and biological aerosols in both indoor and outdoor environments. But for the last 18 months, I've been putting a huge amount of my time into doing research and educating widely on the topics of airborne spread of COVID, in part by curating openly available resources on COVID transmission and prevention. You can find it in my pinned tweet on Twitter, if anybody wants to put that in a live YouTube chat. But importantly, I'm also the father of 3 young unvaccinated children in our local school system. And so I've been advocating there and even doing CO2 monitoring, some of the school and my university in various places. So thanks.
Yeah, thank you. And thank you for being here. And up next is Dr. Elizabeth Jacobs.
Thank you so much, Joaquín. And it's an honor to be here with all of you. I'm a mom. I've got 2 sons, one of whom was able to return to school yesterday when his school implemented a mask mandate. I'm also one of 5 PIs of the Arizona cohort. And one of the things that really got me moving was some of our data showing that in people who were not hospitalized for COVID, they are still reporting symptoms 2 months post-diagnosis, and that is 77% of our study population in Arizona right now. That's been published by Dr. Bell very recently. So seeing that, you can project out to what the consequences are going to be to my loved ones and neighbors in Arizona. And in addition, our governor has attempted twice now to ban mask mandates. And that is the milieu in which we find ourselves. And it also really propelled me to start Right to Safe Schools Arizona, along with 5 collaborators who all connected over Twitter. And just to give you an example of what the situation is here, we have outbreaks already in at least 22 schools. Our schools started on July 21st for some schools. And one elementary school in Arizona currently has 10% of their students infected with COVID-19. So again, thank you for letting me be here with you today.
Yeah, and so glad you're here, and you're doing incredible work, and that is astonishing. 22 schools that have outbreaks since July 21st. So thank you. And next we have Dr. Lucky Tran.
Hi, everyone. It's great to be here. I am a biologist, a science and public health communicator, and organizer in several social justice movements, lately March for Science. So I'm based in New York, so it's been a really intense time over the last few years, as one can imagine. And I'm Australian too, so I have been quite outraged seeing the different comparative responses that we've been seeing. So my work over the last year and a half has been really in my day job to get information and really fight this infodemic and confusion about the pandemic, and really get great information out there, both to the media, help train experts how to speak to the media, and really counter all the misinformation. But outside of that, I've really been organizing with March for Science and with lots of collaborations with like-minded groups, to make sure that we push public policy in a way that follows science and justice. So I think that's really important. And I really want to say that I really empathize with all the parents and teachers who are on here today. You shouldn't be in this situation where it feels like you're having to choose between your children's education and their health. I think that's, it's an outrage, and it's not okay that leadership has left us in this position and failed us. And it's something that we all on this panel here today, we feel, and it really weighs heavy on all of us. But I am heartened to see so many people participating here today. And I think the more we can connect with like-minded people, the more we can empower each other to do something about it. So let's get organized.
Let's get organized. That's what we're doing here. So thank you so much, Dr. Lucky Tran, for being here. Next up is Mary Germanos.
Hi, everyone. I'm also really delighted to be here with you. And I want to echo some of what Andrew Goldstein said, that my experience of the pandemic has been sort of outrage, but also this feeling of a bit of hope when we can come together as people to kind of combat this sense of powerlessness, which I think we all have as individuals. We actually have a lot more power together than we think. And as some of the successful experiences like the San Diego school system have demonstrated, this is also in our hands. And I co-founded a group of mostly physicians and healthcare workers back in last March to sort of push back in Massachusetts at the governor's lack of action here. And a lot of the work we did was advocating for essentially people who were being most affected by the pandemic, Black and Brown and Indigenous communities and essential, quote unquote, essential workers, to actually have a voice on determining how the policies were being made. And I think that is more relevant than ever right now. And I just really want to emphasize this idea that we have a lot of power together. And this is a really heartening group to be a part of. So thanks so much.
Yeah, thank you. So glad to have you here, Mary. And up next we have, let's go back to Dr. Lisa Delano-Wood.
My apologies, I'm juggling a few things today. Yes, I'm Dr. Lisa Delano-Wood. I'm an associate professor in the Department of Psychiatry at UC San Diego and a clinical neuropsychologist by training. And I'm primarily a researcher studying Alzheimer's disease and traumatic brain injury, but I'm seeing a lot of patients now coming in with memory concerns due to long COVID. I am a parent of two, one in the San Diego Unified School District and one toddler. And the decisions that I'm faced with keep me up at night, and my husband as well, as we try to make the best decisions that we can. I started San Diegans for Safe Schools. I co-founded that group with other like-minded parents and physicians and scientists here in San Diego County, and we're now nearly 3,000 strong. We're now Californians for Safe Schools, and it's been sort of humbling. You know, we're starting to realize that, as others of you have commented here, there is this sort of problem with disinformation, misinformation, people believing conspiracies that are really toxic and tragic. And the folks on the receiving end, the people that are really taking the brunt are unvaccinated kids. As someone said here, a little bit ago, it's a pandemic of the innocent. And so what I've learned, I've never really been an activist or an advocate, but that there's power in coming together and not giving up. I encourage everyone to attend their county meetings. So we were in a 5-hour meeting yesterday that was so disheartening and so unnerving, while there were 100+ people in that room screaming about tyranny and Nazi Germany and the toxic chemicals being injected and how they're going to refuse all mask mandates, with only 3 of 130 speakers being sort of pro-public health. So we need to be really paying attention. I know we're focusing on the schools, and that's really where my attention has really been focused all year. But it's coming to a lot of our attention that we need to really be moving toward county and state levels. And it's a lot, but I think, again, we have a lot of power in our numbers and really organizing. My last thing I'd like to say is hats off. Thank you, Dr. Prather, and the rest of this panel. These are some of the most compelling, mind-blowing talks I've heard on COVID-19 and transmission. I'm just so grateful that you put this together and that you invited me and so many to attend. So thank you.
Yeah, and we're so grateful that you're here. And so let's so we'll do a rapid fire question. So it's a yes or no question for everybody here, and then we'll move into more nuanced topics. But the rapid fire question is, should everyone in schools be wearing a mask? So just go for it.
Yes.
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 Yes, 100%.
Yes.
Well-fitting.
Tight and well-fitting.
And
Everyone should have a mask mandate.
All right. That is great. Okay, so we're very clear here. Everyone should be wearing a mask, right? Okay, amazing. So, all right, so let's go into some of these more nuanced questions. So, schools and with Delta, under what conditions would it be safe for unvaccinated children to go back to school while Delta is spreading in their communities, and to maybe go into more details, what conditions would perhaps you as a parent feel comfortable with? Dr. Delano-Wood, and if you want to take this, and then we'll pass it on to Dr. Cannuscio.
It's complicated, and I don't think it's a one-size-fits-all, and I don't think it's cut and dried. I didn't send my 4th grader back last year. I didn't think she could reliably mask. There were concerns about what was going on. We didn't have enough data. I'm leaning more towards sending her for a number of reasons. We're in a good district that's taking this very seriously and listening to the scientists, and always have, with a panel that they convened a year ago. Do we want them to tighten up some things like outdoor masking and required testing? Yes, and they're considering this. I think we're in a strong district, and the school that she attends has strong leadership that isn't sort of COVID minimizing and is trying to take this as seriously as possible. I don't love that these classes are very full, very crowded. There's not a lot of distancing, but they did put, we have air filtration in there, ventilation, and with really good 94, good masking. I feel good. So I would like to see, I think in an ideal situation, obviously low COVID rates in the community. We don't have that. In fact, case rates in kids are 9 times higher now than they were in San Diego a year ago today. So it's frightening, and we have this newer, more infectious variant. So I think I feel good. I know what class my child is starting in. I know the teacher quite well who is vaccinated. I know that the parents are very serious. 2/3 of them stayed home all year last year. But not a lot of people can say that. And so, but I'd like to see indoor and outdoor masking, distancing at lunches, good filtration, distancing as to the extent possible in the classroom. I think the quarantining rules are really quite lax. I don't think kids really even have to test to come back. They just have to be gone for 10 days. And it's just a lot of that sort of Scouts honor type of thing. That's a little bit concerning. So far, the testing is very, hey, it's here if you want it. It's very voluntary. And I worry about that as well. I think that's sort of problematic. But again, I think it's an individual decision. Now, for my preschooler, I've held her back. I'm continuing to hold her back. She had RSV pneumonia a year ago, and it's just concerning. I have her in what I think is one of the best preschools for COVID mitigation, but they still eat inside at lunch. And so like an ER physician said a couple days ago, masks are just for funsies then, is the quote that she gave, if the kids are eating inside. So it's very complicated. I'd love to hear what others have to say, but I feel like it's a day-to-day decision for me and for many parents.
Quickly, I'll just add to what Dr. Delano-Wood said, because I agree with many of the mitigation measures that you mentioned. In addition, I think we need to help our administrators reorient in the era of Delta. We've all now listened to the data today, to very compelling data. And we've seen a pattern throughout the pandemic, I think, of scientists sounding the alarm first, clinicians following, school administrators following then. And so at this critical moment before schools are opening across the country, I think we all need to be in close conversation with school administrators so that they recognize that we can't rely on the experiences from the spring to teach us about how strict we have to be about mitigation measures now. With that said, I think the emphasis needs to be on doubling down on all the prevention strategies we have, not solely emphasizing masks, but thinking about all the tools at our disposal and thinking about using them with the greatest fidelity we can muster. The other thing that I think is very important, and I have 4 children, 2 teenagers and 2 elementary school age children. I think differently for each of those children, as you alluded to, Dr. Wood. Every situation is different. Every school has different resources. Every family has different resources and alternatives available. But every school and every family has to have a plan B and has to be working that plan B and fully developing it so that we can be flexible as we learn more about this new variant and as the pandemic shifts.
Thank you, Dr. Cannuscio. And you mentioned doubling down on mask plus, right? So everything else, using every tool we have available. There are areas with higher vaccination rates, lower vaccination rates. What does it mean? Should people feel comfortable in a higher vaccination rate?
I think like what we heard today from our experts, we should be we should be putting in all the mitigation strategies we can, no matter really what our community transmission rates look like. And I think what we're seeing with Delta, particularly with some of the vaccines like Pfizer, we're seeing breakthrough cases and well more than we expected. And even though folks aren't getting as sick, they can transmit this. And I think the data are there. We know it's there. So in some ways, I think it's a little bit semantics, but I do think that certainly the science shows that you have higher rates in and just higher risk when there's more virus in the community. And so that I would just put as many mitigation strategies in place. And if I were in a very low vaccination state, I honestly would think twice about sending my child back.
Yeah, and Dr. Huffman, can you add some more thoughts on this as well, please?
Well, I don't have a whole lot more to add. I think Dr. Delano-Wood did a great job there. My decision on whether I would send my children or encourage others to send their children if they have the option not to, in a situation where the vaccination rate is lower, changes. So obviously, the better the vaccination rate, the safer for everyone. But that doesn't really change my recommendation in terms of all these mitigation strategies we've been talking about. And I'll say again that masking in schools, HEPA filters, outdoor eating, all these kind of things are the same across the board, no matter what the vaccination rate, I would say.
Yeah. Thank you. And another question, which is, so for example, if the schools haven't done enough to increase safety and reduce airborne transmission, what can parents do? And how have communities successfully organized to implement things like masking, filtration, ventilation? I want to hand it over to Dr. Lucky Tran. Please go for it.
Hi, thanks. This is a great question, and my colleagues are going to share some specific tips, which are going to be great. But I want the big view. I want everyone to come away from this call knowing three things: one, that you are not alone; two, that we have solutions to fix this; and three, that we can win. So, in terms of the first point, you are not alone. I think there's this myth that individualism is rife. We can't. People don't care. But everything that I see, the survey data, whether you look at Pew or KFF or YouGov, all of these surveys show that the majority of Americans don't think the government is doing enough to protect our communities. Most people support masks, and even a significant amount of Republicans also support masks. So don't think that you're alone here. And as you see on this panel, the majority of public health experts think we should be doing more and want to push for more. So we are all together on this. Don't think you have to share the load by yourself. So connect with people, get organized. Number two, we have the tools, the solutions to fight this. Again, I think there's sort of this bad political messaging that is rife at the moment that, vaccines are the only tool that will help, and, there's nothing else we can do. So we might as well do that and hope for the best. There are multiple tools that we have. We've had amazing presentations today on all the different things: masking, ventilation, testing, all of this stuff. I think it's really important. So we have those solutions. So, and I think that's important from an organizing perspective too, because sometimes things can be lightning rods like masks, but there are multiple layers of mitigations that we can pursue, and we should pursue them all, because the more we can get it in place, the more we can protect our kids and our communities. So do follow up on that. And the last thing is really that success and winning is possible. We can make our schools more safer and our communities more safer. I think my experience with the March for Science came into a hostile environment of a government which really did not like science or support science. And even in that environment, we got a lot of things done. We stopped the grad student tax, we made sure science was still funded, and we eventually elected leaders who, put science at the center of their policies. And I think we're starting to see the same despite this difficult environment in terms of public health. So, on the national stage, I think people have really pushed that conversation on masks. And I know the CDC said they changed their guidelines according to new data, but a lot of that was also because of really strong advocacy. So that was a win. And at the more local level, we're seeing, really creative solutions. So for instance, I know in Texas, one school district had a really creative solution of requiring masks after using the dress code, and implementing it in the dress code as a loophole to bypass the ban. So that was a really creative solution. And one thing I like that from an organizing perspective is it creates a decision dilemma, because a lot of people support the dress code for other reasons. So it sort of feels hypocritical to not support that in masks as well. So that's a smart thing. A lot of superintendents I know in Fort Worth, in Dallas, in Houston, other places around the country too, have gone against the governors and ordered mask mandates despite that. So they're a great ally potentially in your area. And then I know a number of states have banned mask mandates, but a number of states have also filed lawsuits against this. And there's some success in places, again, like Texas and Arkansas, who have had some of those mandates suspended. So those are reasons for hope. And generally, I know a lot of that stuff is legal, and I think Whitney and others will talk about more specifically about that. But one other thing I want to say is that we do need to build a grassroots movement, leverage, social media, leverage our communities, and leverage the media to build this momentum. Because the more people we get on board with this cause, the more we visibilize it, the more new people you get to help, the more you make it an issue, and the more we can win. So please get organized. And I'll leave you with that quote that it always seems impossible until it's done, from Nelson Mandela. I think, it does seem a difficult environment right now, but look how many people are on this call. Look how many people are presenting today. We have the people to change everything. So, we stand with you, get organized, and I'll hand it to my colleagues.
Thank you so much, Dr. Tran. Absolutely. And you mentioned, states banning mask mandates. Dr. Jacobs, who is in Arizona and has been working on this, can you share more of how communities have been successfully able to organize to change this?
I can, and I know we're running short on time, so I'm just going to keep this quick. We organized. I've never done anything like this before in my life. It is just the momentum that has carried us to start making steps and things available in our toolkit that you just click on it. You can find the information you need to contact your elected officials, your school board, whatever you need. It's at Right to Safe Schools AZ. And now I would just like to really talk to the people who are watching this right now and say how much we need you to step up. So somebody just mentioned that a school board meeting had like 100 speakers opposed to masks and 3 supporting it. And that's what's happening because we aren't yet organized. I think a lot of us are thinking, this is obvious, we should have mask mandates, only to find out just before school starts that you don't have one yet. So I am looking out to all the people who are watching this, and I am asking you to help us, please. We need your support, and we need to keep pushing for mask mandates in schools, for filtration systems, and for vaccinations. Thank you.
Yeah, thank you. I know Mary has some more thoughts on organizing as well. Please go for it.
Yeah, thank you so much. And as Dr. Jacobs just pointed out, some people get involved at any moment in organizing. It doesn't have to be something that you've been doing your whole life, which is some of us on this call, have been organizing since we were young. But I guess I just wanted to emphasize the importance of if you feel alone, reaching out and doing a mapping, for example. That's one of the things we're doing here in Massachusetts. For example, think of who are your potential allies on your local city council, which teachers in the schools. Think about the teachers union and what kind of policies they've been advocating for, the local nurses unions that have been very active across the country actually on COVID safety, and really building a coalition inside each at a local level. It looks different everywhere, but the sort of process is the same. And reaching out to each other and to people on this call and kind of making the scientific information, all of these sort of fact sheets that exist and that are being produced actionable and making them available, because I think, it's a sort of 2-step process. There's education. There has been a lot of misinformation about this pandemic. We need to educate ourselves and each other, but then we also need to work together to make those steps meaningful in our communities, and that looks different everywhere. So yeah, I really just want to kind of emphasize that we, again, like I said, we have way more power than we think we do.
Thank you, Mary. And Whitney, what if we have a scenario where someone is told, someone from the school tells a child to take off their mask? What are the, what are parents' rights there?
If someone tells a child to take off their mask, the child, has every right to continue to wear it. It's an interesting question. The child does not have to comply with that request. That is, I can't imagine any context where that would be required. The points that I really wanted to speak to include things like that, where there's confusion about what can someone do and not do. And I want to address the perplexed distressed parents, like we heard from Dr. Delano-Wood, and some ways that a parent or a community member can follow on the tips that Dr. Tran gave us and Mary just gave us as well. So when you want your school to do something, like make sure the teachers don't tell your child that they have to take off their mask. You need to educate your board. You need to know what they can and can't do in terms of governance, and you need to advocate for what you want to see happen. Give it to them in a neat package. I put together a deck of slides with some really specific examples. I'm going to throw it into the YouTube chat, and it breaks down the strategies that I've outlined: educate, advocate, agitate, and then litigate if you have to. And some really specific things, because as a board member, I'm certainly not an expert in this. I've learned so much sitting here today, and I can assure you a vast majority of board members around this country have decision fatigue. They're being attacked by anti-maskers, anti-vaxxers, anti-CRT. It is exhausting. But if you understand what they can and can't do and give them the tools to do it, they want to do the best for kids. I can assure you. So I'm going to pop this in the chat, and it includes my Twitter handle and my personal email. And I'm always happy to brainstorm these things to help you in your community find the right board members. Like Mary said, find the sympathetic people, get them the information they need, understand the abilities that they have, the parameters they have to work in, and empower and enable them to really make those policy changes for the health of our kids based on everything we've learned here today. Thank you so much,
Whitney. And I'm glad we're spending a little bit extra time here on this organizing question, because, you know, what can parents, teachers do next, right? Dr. Goldstein, you're a doctor, you're an organizer. Do you have some more practical tips?
Yeah, absolutely. Thank you. So I think many of us aren't fluent with the political toolkit for people power, and we need to think about what that actually looks like. And so many of us are on social media. We've signed petitions. We're doing teach-ins and webinars like this one. Maybe we've called a legislator or other decision maker, signed on to letters. These policy methods of like pressuring politicians work, but they're best when they're on ramps to more escalated action, or when the numbers are so high that the numbers alone are very compelling. So I think most of us are less familiar with lobbying, with canvassing, with visual actions, with bird dogging, with fundraising for political opponents, with strikes. And these are some of the tools that are available to people. And some of them specifically that I've seen or seen talked about for school safety have been, what does non-attendance at schools look like when schools are not safe enough? What does non-attendance at work by parents look like when they have to be home with children? What can teachers do that doesn't actually leave the classroom neglected, but still doesn't comply with the powers that be? And so things like not taking attendance, not marking attendance, but still showing up to teach, that actually has consequences for the school's bottom line. Bird dogging principals, bird dogging school board members. This is a way of going up to them wherever they are in the community and repeatedly asking them questions. What are you doing? What are you going to be doing this week, given that cases are so high? When will there be a mask mandate? And these tools exist for everyone. And I think we just need to look to the role modeling organizations that we've had from many other causes, whether that's ACT UP and AIDS activists, whether that's union organizers, whether that's the grassroots people who stopped ACA repeal. So the toolkit's there, and I would just encourage everyone to work on exploring it and finding communities of action that can support you in doing it. To Lucky's point, we are not alone, and we can definitely use an existing political toolkit. So I would encourage everyone to explore more and to continue to be in touch.
Yeah, absolutely. We are not alone. And you know, the point you're making about asking them, hey, what's your plan? What are you doing? Holding them accountable, you know, making a front and center, I think is incredibly important. So thank you for all your work, Dr. Goldstein. So we're going to switch gears a little bit here and talk about transmission. And this is a really important question that a lot of parents are asking right now. We've seen cases of what they're calling fleeting transmission in Australia. So, you know, what are the risks for children if they're outside? You know, what are the risks of fleeting transmission? And so let's go to Dr. Huffman.
Sure, thank you. So first of all, I'm not an infectious disease scientist. I'm an aerosol scientist, but I'll give my perspective on that. And this is a rapidly evolving situation. And so I think that there needs to be some grace even in the way we think about this. And there may be some differences even the way we think about this a little bit on the panel. But I think that no question there's worrying cases of outdoor transmission, certainly in crowded outdoor settings like festivals that I frankly would just avoid right now. But even just recently, a couple in Australia where it looks like there may have been possibilities of some children playing on a playground and outside and maybe walking to school. So really, anytime you're close enough to breathe in air influenced from somebody else's breath, you have a chance of being infected. But I still think that outdoors is wildly safer than indoors. So we don't want to miss that point. Indoors, not only do you have the exposure from the aerosol plume that hits you in the face, but you also get that buildup in the room. And so outdoors, if you're far enough away to be outside that breathing zone, the chances are dramatically lower. So if your kids are playing outside and they're really close to each other, then there can be some risk, and you may choose to have your kids wear a mask in that setting. And certainly that can provide benefit. But I also think that from my perspective, there's an importance of being practical here. And this is where the strategy that is not my field comes in. We all need breaks from masks, and getting some fresh air outside without a mask on is really important. The last thing we want to do is push this so hard that we cause fatigue so that people don't wear their masks indoors. We really, really need them to wear them indoors, where it's especially critical. In certain situations outside, I think it can be useful. So some risk outside, yes, much less than indoors. A little distance is helpful. But still outdoors is much lower on my worry list than indoors in certain settings.
Yeah, thank you, Dr. Huffman. And it really speaks to the changing nature of risk with Delta. And so keeping those things in mind, like practicing social distancing if outside, are incredibly helpful to reducing that risk. So, in different places, different resources are available. There's a different type of infrastructure that's in place. The weather may affect what precautions can actually be implemented. So what are some solutions in cases where, maybe it's raining or maybe ventilation isn't readily available? And Dr. Cannuscio, if you can speak to that.
Sure. So many people on this call are probably very anxious about kids eating together at lunchtime because of all the evidence that we've seen of transmission while people are eating together. So I want to give people a basic structure for thinking about how to organize life at school and what to advocate for at your own children's schools or at the schools where you work. Outside is better than inside, always. And then if you must eat inside, think about ventilating the indoor space as well as you can, but also having small numbers of people in the largest spaces possible for the shortest period of time possible. So small numbers of people, largest spaces possible, and the shortest period of time possible. So even though we're all operating in very different physical settings, geographies, different levels of resources, those same rules should apply if people must eat together. Now, it's also been the case for many schools that they've structured their school day so that children are in school only for half days, for example, so that they're not eating together. And I think as rates get very high, the more extreme measures may become relevant, i.e. going to hybrid schedules, reducing the number of kids at school or in class in any period of time, or going full remote. So small numbers of people, large spaces, short periods of time.
Yeah, and if you could just follow up here with, in case there's cases or outbreaks, in order to prevent onward transmission, what steps should be taken?
Okay. So recognizing that we're short on time and that this could be a whole semester long course, I want people to know that cases will occur in schools across the country. They will happen even if mitigation measures are in place. So it does not mean that your school failed or that someone tried to dupe you or that people are trying to put children or adults in the school buildings at risk. So given that cases will happen, our whole agenda has to be to identify those cases early and to make sure those cases don't turn into outbreaks. So that means we need to have plans in place for testing. We need to have plans in place for contact tracing. We need to have plans in place for quarantine and isolation. And we have to have plans in place for supporting families that are in quarantine and isolation. So each of those steps, the testing and case identification, the contact tracing, the quarantine and isolation, the support for families in quarantine and isolation, each of those things needs a point person or a committee that has really studied up on how to do these things, because in many parts of the country, your local health department will not be able to have the bandwidth to do that tracing and outbreak investigation for you. And there are those of us who have done a lot of this, who are willing to give some coaching and counsel on how people and institutions can do this. The important thing is that we can't just tell people to isolate or quarantine and then leave them alone. People have so many questions about how to stop transmission even within their households. So that's another part that people have to really study up on. And all of these strategies that we're talking about for schools are connected to what happens in people's households and what happens in the community. So all the best prevention steps have to be taken in all parts of our lives. I know that I glossed over a lot there. So if people have follow-up questions, there's going to be a conversation on Twitter, I'm sure, too, and all our handles are available online.
Great. Thank you, Dr. Cannuscio. And I do want to move to a question from a participant who has a greatly powerful story. But I do want to take an opportunity here. If anyone had any closing thoughts that they wanted to share, please go for it.
I'll say something. I just wanted in my closing thoughts, just really emphasize the indoor eating aspect of that we've talked about several different times, but I just wanted to emphasize it forgive an imperfect analogy, but I think that this kind of brings it home a little bit. Really, this is the same issue for restaurants. Whenever you take your mask off indoors, you have tremendously more aerosols in the room. There are mandates that take care of restaurants in a lot of cases, but we're just not being careful about schools. And so we just need to eat outdoors anytime we can. My imperfect analogy is wearing masks indoor all day, only to take them off to eat indoors together, is a bit, to me, like a class being together in a big pool where everyone holds their bladder for several hours of swimming. But at lunchtime, everybody gets out of the pool into the hot tub for a few minutes where they all pee. So it's great that they weren't exposed to pee for most of the day, but they interact with it a lot in those few minutes. So it's the same as true at lunch. You could breathe a lot of virus in that 10 or 20 minutes that you're there, that invalidates hours worth of wearing a mask. Now, it's an imperfect analogy. There's a lot going on there. I still want people to wear masks, but the point is we need to treat indoor eating really seriously at school. So, and what Carolyn said a few minutes ago, we have strategies that we can deal with this. Small numbers, be quick, don't talk, ventilate, HEPA, but also give some time to flush out the air before another group comes in. This is a really important point. I've done some modeling on this, and this is one of the cheapest ways that you can really add value to the quality of the airspace, by just stagger it by 15 or 30 minutes or an hour if you can, to really fresh out that airspace. Thanks.
Yeah, that's great. Great suggestion. Does anyone else have any additional closing thoughts?
I'll just add a quick thing. I know we're kind of moving. It's been a long time. Folks have been really patient. I would say rise up, stand up, speak up. Do not fear. Do not fear these folks that are out there threatening, and just go to the meetings. You can call in. You can be on video. Write your council members. Go beyond the schools. Many of these districts are waiting for word from above. So go to the county, go to the state, find out who you can write, and connect with other like-minded people like you. You're not alone, and you're in the vast, vast majority. So please know that this small, well-funded group of folks that are out there agitating and really threatening the very fabric of our democracy are very, very small. And we see a lot of these people traveling to all these different districts, by the way, and pretending that they're in. But so anyway, rise up, stand up, and really don't be fearful, and get out there as much as you can.
Great, and thank you, Dr. Delano-Wood and Dr. Goldstein.
Yeah, just a few closing thoughts. So one, don't rely on other people. We keep us safe means that we all have to show up. Only you have your own personal actions. No one else can show up for you. Only you have the relationships and communities that you're a part of. Also, passion is energetic. Dedication of time is inspiring. Your personal stake, sharing that with other people, that's compelling. And highlighting the moral stakes for yourself and for society is really powerful. I'd also just add that like nervousness is very real, especially with politics, with public speaking, with meetings, with making personal asks. But honestly, with like, having more support, having practice at it, it goes away. Ditto with just not being as familiar with political tactics and strategies, having more support and practice with it can really, make those discomforts go away. We need to have like unity of issues. This is not just a schools issue. The same forces that are driving unsafe schools are driving unsafe congregate living for people in prisons and shelters. It's driving unsafe work conditions for workers. We need to have a unity of these issues. Solidarity is contagious and these issues are deeply connected. And then just super practically, budget time. Budget your own personal time that you want to dedicate to political work on these topics, and then show up for that time in your calendar. And really practically be in touch with 5 people you know in the next day or 2 about this. Engage 2 existing communities or organizations that you have a relationship with in the next day or 2 about this, and get conversation started.
Yeah, everyone is sharing such great practical tips here. So thank you so much. We have one really great participant and who's been doing a lot of amazing work when it comes to long COVID and children. Melissa Lynch, are you there?
I am. Thank
All
you
right,
for
please,
having me.
go for it. Thank you. Please share your story and please share your question. Thank you.
My story is I am global ambassador for Long COVID Kids, and I'm also lead director for Long COVID Kids USA. I am a mother of a 12-year-old long hauler who is 11 months out, continues with symptoms. And I also helped draw up the administration, the bill that was signed on the 26th, the guidelines for schools, because back then she didn't even have school accommodations. No one knew what long COVID was. And I wanted to ensure that these kids didn't have to worry about their education along with the changes in their health at the same time. My question is a lot of these politicians, school boards are now trying to find loopholes, as they always do, around the accommodations. So how do we go about fighting that? And one thing that I would like to say to keep in mind, that 1 in 15%, 1 in 15, and it can be up to 30% do get long COVID. And it can be asymptomatic. You can show no symptoms, and it can be all the way, they're just now finding out from, hospitalizations can even get long COVID. And just keep that in mind as the pediatric surge is happening with the Delta, that, 1 in 15 can get it, 80% will be female. So we're going to have really a future, with chronic illness on our hands with a whole generation. But thank you for having me on here, and thank you all for your wonderful work. I've learned so much. Visit longcovidkids.org. We have an international back to school packet for long COVID. And I'll let y'all answer one of my questions. Thank you so much, Joaquín.
Thank you, Melissa. I'm so glad you were here to share your powerful story and work that you've been doing as well. I think that it's an inspiration for many. And so my heart goes out to you because, we've talked before about, what your daughter is going through. So So thank you again for being here. So anyone on the panel or any other, maybe Whitney is a good person to answer that question, since it's it talks about parents' rights here. If Whitney, if you can share a little bit, and if anyone else from the panel wants to share.
Yes, thank you, Melissa, for sharing your personal story. I'm so sorry for your daughter, and thank you for bringing our attention to this incredibly important issue. Long COVID should qualify as an American with Disabilities Act protection, and protection for children with special needs. And so what we need to do legally is make sure that they are meeting those needs. And I know you worked on the bill with President Biden to set some parameters, but we don't want the kids to get lost in the shuffle. So I think the first thing to notice, I think you're in North Carolina, different state law is different, but equity in education really applies. That term started with children with special needs. And I think that your daughter would qualify as that at this point. So you need to make sure she has an advocate for those services and that she doesn't fall through the cracks. Every state has different guidelines, but that's what I would advise, because she's entitled to a lot more help than she's probably getting.